You may have forgotten or been putting off your child's dental visit. You all of a sudden remember.
Hi everyone, I'm Mark Dawoud, D.M.D, and I'm a Board Certified Pediatric Dentist. Subscribe to the channel for upcoming videos. And don't forget to hit the thumbs up button.
The good news is you remembered, but you're a little anxious because you're worried how your child might react.
Or maybe you have your own underlying fears about the dentist. What if they find the cavity? You're worried your child might have a bad experience and not want to return. Maybe you're worried about being judged for using the wrong toothpaste, for example. If you're worried about toothpaste, I'll have options for you in the description below.
I probably don't live in your area, so the first thing I do is get recommendations from friends and family on local dentists in your area. A pediatric dentist may be a good choice for your child, but depending on the area, it might be hard to find a pediatric dentist. If you're new to the area or if family and friends aren't very helpful with recommendations, you can look online and visit the office website to make sure that the office is the right fit for your child. This next part is pretty important. If you're going to try to explain the visit to your child, use your words carefully, especially if your child's pretty anxious about the appointment.
First, avoid talking about your past negative experiences. That time you got a shot or had a tooth removed at the dentist may not be the story you want to share with your child before their dental visit. I've seen parents share these stories with their children in the dental office. After seeing how many children react after hearing these stories, I personally strongly advise you do not share those stories.
Avoid using the following words: hurt, pain, shot, needle, pulling a tooth, removing a tooth, drill. More on this soon.
By no means am I telling you to lie. Absolutely do not lie, but it may be wise to avoid words that can elicit anxiety about an upcoming visit. I'll show you common instruments that the dentist will use. I'll tell you how to describe these instruments to your child. You can also buy some toy dental instruments to help your child get familiar with the upcoming visit. I'll have a link in the description below. Don't forget to subscribe and hit the like button.
We'll start with the easy stuff, the mirror. Pretty self-explanatory. It's a tiny mirror so the dentist or the team member can easily look in your child's mouth. The next instrument is what dentists call the explorer. For the purposes of your child, this is a tooth counter. You can also use this explorer in the toy kit to count their fingernails. This tooth counter helps the dentist count your child's teeth. I would avoid using terms like pick or sharp thing. During the cleaning, a dentist or dental team member will use a polisher to clean your child's teeth. Please avoid using the term drill. If your child does need a filling, the dentist will use a water whistle to clean the tooth. Again, try to avoid the word drill.
What to do if your child asks you if it's going to hurt? You might not know the answer to this question. Remember, it's important to be honest, but choose your words carefully. You can say the following to your child. It might be uncomfortable, but let the dentist know so they can make you comfortable. When saying the word uncomfortable, your child will hear the word comfortable. In contrast, if you say the phrase, it will not hurt, your child will hear the word hurt, even though you're saying it will not hurt. Okay, if you've gotten this far in the video, you have some tricks up your sleeve to help keep the upcoming visit positive. This is called positive pre-imagery, where your child has a positive view of the dentist. If your child is still nervous, the dentist can implement some different techniques.
Like tell, show, do to gain your child's trust. Tell, show, do is a technique where a member of the dental team will tell your child what they are going to do in a child-friendly manner, show them the instrument, like the mirror, for example, and then do the exam or the cleaning. Another technique in the dental office can be direct observation. If your child is nervous, you can have your child observe another child in the dental chair, such as a sibling, friend, or relative. Positive reinforcement, in my opinion, is one of the best tools you can use. Make sure to tell the child they are doing a great job, staying still, or keeping their hands down or opening wide. With this technique, however, you have to be specific. For example, you can say, "Good job, keeping your hands on your belly, Susie." Saying a general "good job" does not reinforce the specific behavior you're trying to reinforce. And definitely do not praise behavior that you want to keep at bay, such as frequent moving. And distraction is also a great technique when taking x-rays or with other more uncomfortable events during the visit, like receiving local anesthesia. Nitrous oxide or some form of sedation may be recommended in the event a procedure such as a filling or tooth removal is recommended. This may depend on the work and the child's cooperative ability. If your child needs a filling or a crown, remember, if work is needed, do not use the term drill. Try to say instead, the dentist is going to clean your tooth with a water whistle. Crowns can be explained as superhero teeth or princess teeth, depending on your child's age, but I would have a conversation with your dentist or dental team on how to talk about this with your child. If a tooth is recommended for removal and your child is asking questions, consult first with your dentist or team on how to address this. You could use the term wiggling the tooth versus pulling or removing the tooth. I personally like the term wiggling the tooth. If possible, try not to express your anxiety to your child about the visit. Sometimes children pick up on changes in your body language and voice. If you feel like this might be the case and you want to be present during the procedure, you can provide them support by just holding their hand and letting them know you are there for them. I hope this video was helpful. Please hit the like button, leave a comment, and subscribe. Let me know what other videos you'd like to see by leaving a comment.